Yeah. Welcome to my channel. Adeshola Onide is my name. In this channel, what I do is to give you learning tips. And sometimes I pick topics in biology and medicine and discuss them in a very simplified manner to aid your study. Always ensure you visit this site regularly. Thank you. Hey guys, if you are new in my channel, please kindly click on the subscribe button to encourage me. Thank you. Okay, now the next thing we should talk about is the Zollinger-Ellison syndrome. Now, when you hear the word Zollinger-Ellison syndrome, the first thing that should come to your mind when you hear the word Zollinger-Ellison syndrome is gastrinomas. Primary problem is we have tumors, and these tumors that we're talking about, they are coming usually from the pancreas. Non-B cell pancreas islets. They are producing excess gastrin, which is the primary problem. We have gastrinomas that produce excess gastrin. This excess gastrin causes increased hydrochloric acid production. Now, increased hydrochloric acid production leads to ulcer. So if you will not remember anything about Zollinger-Ellison syndrome, remember that there are some tumors that are commonly found in the pancreas called gastrinomas. They are gastrinomas because they are gastrin producing in nature. And you remember the function of gastrin, always regulating hydrochloric acid production. Gastrin primarily act on the parietal cells to ensure they produce hydrochloric acid. Now, because these gastrinomas are producing excess amount of gastrin, then there will also be excess hydrochloric acid production, and this will lead to ulcer in the stomach, ulcer in the intestine. Especially look at where we can have the ulcer. We can have the ulcer in the esophagus, we can have the same ulcer in the stomach, we can have the ulcer in the duodenum, then we can have the ulcer in the jejunum. If you understand this, then it will be easy for you to get what will be the clinical features and the laboratory investigation that should be done for a patient with Zollinger-Ellison syndrome. Primary problem, gastrinoma. Gastrinoma producing gastrin. Gastrin increasing hydrochloric acid production. Increased hydrochloric acid production is increased hydrochloric acid production is resulting in ulceration in the esophagus, in the stomach, in the duodenum, in the jejunum. All right, that's the primary thing. Another thing you should always remember is that this Zollinger-Ellison syndrome is actually sporadic in nature. The tumors, we just realized this non-beta cells islet tumor that we said is produced from the pancreas, they are sporadic in nature. However, there's about 20 to 25% that is familiar, which is associated with what is called MEN1. MEN simply means multiple endocrine neoplasia, meaning we have many endocrine cancer that are involved. So now we are saying that in men type 1, gastrin can be one of the hormones. Don't forget multiple endocrine. We are saying many hormones are produced, and men type 1 has been associated with gastrin production. Now, just the same thing, the gastrin that is produced acts on the parietal cells. Parietal cells produce hydrochloric acid. Hydrochloric acid will result in ulceration, esophagus, stomach, and small intestine. On that ground, what will be the clinical features? Because of the ulcer in the stomach, what will happen? The person will have abdominal pain. Because of the ulcer in the esophagus, the person will have chest pain. Do you understand? The person will have odynophagia, pain while swallowing. The person will have dysphagia, difficulty in swallowing. Because of the ulcer in the small and large intestine, the person will not really absorb a lot of food like that. The person may have what is called malabsorption syndrome. Then the person will have weight loss. Why? Because the person is not really absorbing a lot of food. Then the person will bleed because of the ulcer. Now, there's the general name for general feeling of unwellness that has to do with GIT is what we call dyspepsia. So those are the symptoms of the Zollinger-Ellison syndrome. So the triad is this. We have pancreatic tumor, excess gastric acid production, then peptic ulcer. The triad of Zollinger-Ellison syndrome: pancreatic tumor, which is gastrinomas, Then we have gastric juice, gastric hypersecretion, gastric acid hypersecretion. Then we have the peptic ulcer. Now, always remember that this ulcer can be seen along the entire GIT, although it is common, it is found more frequently in the stomach and the small intestine. And the treatment is usually either medical or surgical. The medical is by giving drug, the proton pump inhibitors, the omeprazoles, the prazoles and the prazoles. Then the surgery is by surgical resection. They just resect now. But we focus more on the laboratory investigation. All right. Now, what are the laboratory investigations? You can reason it out actually. Now, we have said gastrines. So what do you expect? You can check the pH and there'll be what? Increased acidity. It's that simple. When you measure the fasting gastrin, what will happen? The level will be elevated. Elevated gastrin level. You understand? The next thing, what do you measure? Calcium. Calcium level will be elevated. Why? Because we have told you that is associated, men type 1 is associated with other hormones, and one of them is hyperparathyroidism. And you remember parathyroid hormone always increase serum calcium. So you can have in men type 1, the one that is associated with men type 1 will be associated with increased parathyroid hormone production. At the same time, it will also be associated with increased calcium production. Why? Because parathyroid hormone can increase calcium level. Then we have said when they carry out gastric acid secretion test, what are we going to find out? We realize that the basal acid output is elevated. Why? Because gastrin is elevated. If gastrin is elevated, fasting serum gastrin is elevated, then you expect the basal acid output to also be elevated. Then they can do what we call secretin stimulation test. When secretin is administered, what do we expect? We expect that at least it should act against the gastrin. They can do bombesin stimulation test. Then when they do imaging, they will see the sign. They will see the sign of ulceration. When they do protein meal test, also a radiologic investigation that will help us to see all those sites of ulceration. So those are the most important things you need to know. We have said medical treatment is by giving proton pump inhibitors, and we can do surgical resection. Then the next thing we want to talk about is what we call Werner-Morrison syndrome. When you hear Werner-Morrison syndrome, just think of lipomas. When you hear Zollinger Ellison syndrome, what do you think about? When you hear Zollinger Ellison syndrome, what do you think about? You think about gastrinoma. When you hear Werner-Morrison syndrome, what should you think about? Thank you for watching this amazing video. I am